The circle of Willis. Anatomy and clinical significance. Cerebral circulation explained. Introduction. Welcome back to the Everything Surgery podcast. Today, we're diving deep into the fascinating world of neuroanatomy, focusing on a crucial structure at the base of the brain, the circle of Willis. Whether you're a medical student, a healthcare professional, or simply curious about how the brain's blood supply works, this episode will guide you through the anatomy, function, and clinical relevance of this vital arterial circle. Let's get started. What is the circle of Willis? The circle of Willis, also known as the circulus arteriosus, is a remarkable arterial network located at the base of the brain. Named after the English physician Thomas Willis, it serves as a central connection between the anterior and posterior blood supplies, ensuring your brain gets the circulation it needs, even if one pathway is compromised. Anatomy of the circle of Willis. Let's break down its anatomy. The circle of Willis forms a polygonal loop of arteries that encircle the optic chiasm, pituitary stalk, and hypothalamus. Anterior circulation. Carotid system. Internal carotid arteries. These are the major arteries entering the skull, dividing into the anterior cerebral arteries and middle cerebral arteries. Anterior cerebral arteries. These supply the medial surfaces of the frontal and parietal lobes, connected by the anterior communicating artery. Anterior communicating artery, a short but critical vessel connecting both anterior cerebral arteries, often a site where aneurysms may form. Posterior circulation. Vertebrobasilar system. Vertebral arteries, arising from the subclavian arteries. These merge at the base of the brain to form the basilar artery. Basilar artery, running along the pons. It eventually divides into the posterior cerebral arteries. Posterior cerebral arteries. These supply the occipital and inferior temporal lobes and are connected to the internal carotid system by the posterior communicating arteries. Posterior communicating arteries. These vessels link the internal carotid arteries to the posterior cerebral arterius, completing the posterior portion of the circle and, again, are common sites for aneurysms. Completing the circle. The circle of Willis is completed by, anteriorly, the two anterior cerebral arteries plus the anterior communicating artery, laterally, both internal carotid arteries, posteriorly, the two posterior cerebral arteries and the posterior communicating arteries, with the basilar artery feeding into the PCAs. However, it's important to note anatomical variations are common. About 50% of people may have an incomplete circle due to hypoplastic or absent components. Functional significance. Why is this circle so important? Its main role is to provide collateral circulation. If one artery becomes narrowed or blocked, the circle of Willis can redirect blood flow, helping to prevent ischemic strokes and maintain adequate cerebral perfusion. Clinical correlations. Let's discuss some critical clinical points related to the circle of Willis. 1. Ischemic stroke and collateral circulation. Anterior circulation stroke. Carotid system. Blockages here can result in contralateral hemiparesis, facial droop, or aphasia, especially if the dominant hemisphere is involved. Occlusion of the anterior cerebral artery may cause greater leg weakness. Posterior circulation stroke. Vertebrobasilar system. Basilar artery occlusion can lead to locked-in syndrome, while posterior cerebral artery occlusion can cause contralateral homonymous hemianopia. If the circle is incomplete, the risk and severity of stroke increases, as collateral flow may be insufficient too. Cerebral aneurysms. The circle of Willis is the most frequent site for intracranial aneurysms due to the turbulence at arterial junctions. Common sites. Anterior communicating artery, about 30 to 35%. Ruptures here can cause subarachnoid hemorrhage and frontal lobe dysfunction. Posterior communicating artery, about 25%. Compression here may result in oculomotor nerve palsy. Middle cerebral artery bifurcation, about 20%. Basilar tip posterior cerebral artery, 5 to 10%. Risk factors include hypertension, smoking, genetic syndromes, like polycystic kidney disease, and certain connective tissue disorders. Symptoms of rupture. Sudden, severe headache, often described as the worst headache of my life, with possible neurological deficits. Photophobia, and neck stiffness. Diagnosis is typically through non-contrast CT, lumbar puncture, or angiography, while treatment may involve endovascular coiling, surgical clipping, and the use of nimodipine to prevent vasospasm. 3. Vascular malformations and anatomical variants. Fetal posterior cerebral artery. In about 20% of people, the The posterior cerebral artery is mainly supplied by the internal carotid. This variant can increase stroke risk if the internal carotid artery is blocked. Incomplete circle. Up to 25% of people have missing or underdeveloped arteries, which compromises collateral flow. Moya disease. Progressive internal carotid artery narrowing leads to compensatory vessel growth, giving a puff of smoke appearance on angiography and causing recurrent strokes or TIAs. Treatment involves surgical revascularization for diagnostic imaging, computed tomography angiography, quick and detailed, especially for aneurysms. Magnetic resonance angiography, great for screening, with no radiation exposure. Digital subtraction angiography, the gold standard for aneurysm evaluation. Conclusion. So, to wrap up, the circle of Willis is not only a marvel of human anatomy but also a critical safeguard against stroke and other vascular events in the brain. Understanding its anatomy and variations is essential for anyone interested in neuroscience, medicine, or health. Thanks for tuning in. Don't forget to subscribe for more deep dives into the wonders of the human body.